Hi friends, welcome back to my channel. Thank you for supporting me, and I am so happy to hear that my channel is beneficial for many of you like OET aspirants, and keep supporting me. And if you are watching first time, please subscribe, like and share it to your friends. So today I am here with one OET case note. So first of all, what we have to do once you get the case notes, as you know, it's mentioned here, the reading time is 5 minutes. At that time, you cannot take any pencil or pen in your hand. So what you have to do, you can just prepare in your mind. So you can make a skeleton of your letter. So in that time, just see what is our position and who is our reader, and is there any relationship with the reader, means is it a known case or an unknown case. Then what are the relevant information I have to include in this letter in order to provide the care for the patient. So other information we have to omit it, otherwise it can affect our score. That means if you exceed the limitation, the word count 180 to 200, or if it's less than 180 also, it can affect your scoring. So we should be careful when we are selecting the information. Only to select the relevant information for the reader and omit the irrelevant, and if the word count is not meeting, so you can just use the semi-relevant information. I think it's clear for you. So let's see this letter. So today's date is 24/10/2015. And one more thing I would like to mention is that during this writing time, even though they mentioned that you can start writing now, what you have to do, take another 5 minutes to make a plan of your letter. So in that time, you can just make a plan. So who is our reader, like that. Then the relevant information we can select and the others omit. So if you make a clear plan with 5 minutes, it will be easy for you to write the letter within 30 minutes. Then you have still, from this 40 minutes, you only took 5 and 35. Still you have 5 minutes for the proofreading. So in that way you can find out any mistakes in your letter, like grammatical error or any capitalization or gender change. Even sometimes we start with the patient is here, see, it's Mr. Sergio, but when you are writing, and it can, maybe you write he became she, like that, it can affect your scoring. Means from 350, if you, even though you wrote very well, with this minute mistake, your score can drop down to 290. So be careful when you are writing. The proofreading is a must. So let's start with this letter. The today's date is mentioned here, 24/10/2015. Then you are a nurse working in National Hospital. Patient details is given. Mr. Sergio Marquina, age 40 years. Then marital status is married to Mrs. Raquel. Admission date is 15/10/2015. Discharge date is 25/10/2015. But be careful, the discharge date is 25 and today's date we have to notice this is 24/10. So the patient will be discharged tomorrow. If you write today means it will be wrong. Then social background. Before we proceed further, we should know who is our reader. Where you can find this information, it can find in the writing task. So for this letter, who is our reader? Using the information in the case notes, write a referral letter to Mr. Alvaro Morte, Physiotherapist, Newtown, Spain, for continuity of rehabilitation at home. So what all information we got from this writing task? This is a referral letter. To whom we are writing? To a physiotherapist, and his name is Alvaro Morte. And what is the purpose of writing this letter? For continuity of rehabilitation at home. Then if you didn't get clear explanation from this writing task, just move on to the upper part. In the discharge plan, it will be more clear. So continue physiotherapy at home to regain mobility, education regarding safe exercise programs, effective use of walking aids, diet management, self-care assistance, return to hospital for occupational therapy. So here also it's mentioned clearly what he has to do. Continue physiotherapy at home to regain mobility. So let's go back to the initial phase. Then here it is given the social background. He is a retired professor, no history, medical illness, chronic smoker 20 years, alcoholism 15 years. Do you think you have to include all this information for providing a physiotherapy rehabilitation care? No need, isn't it? If the word count is less, you can just include this too. Retired professor, then no medical history. Then what happened to him on 15/10? How he was admitted to this hospital? So we have to provide that information to him. Hip fracture due to road traffic accident. Then vital signs are mentioned. If it's normal, no need to include. Then what the treatment? Intravenous food therapy. Then 2-unit PCV transfusion, surgery, or if. You see, they are using the acronyms here. So what you have to do, you have to practice acronyms, because if you don't know these acronyms, you cannot ask any help from anyone. So you cannot elaborate it. That means, and even you can make some mistakes. If you provide wrong information, your letter will be totally different from what they are expecting. So you cannot get your expected score for the letter. Then ORIF means open reduction and internal fixation. I have done several videos, even shorts videos. You can see there are a lot of acronyms. So just try to practice it before your exam. Then after that, what they have done, the pain management. Pain is controlled with the morphine. Then what happened on 17th? After 2 days, wound clean and dry, no infection, no fever, stable hemodynamically. Then 18th, reference to physiotherapist, assessment, movement and alignment, assisted walking, provided walking aids. Then 19th, can walk short distance with aid or assistance. Then weight bearing exercise, pain management with morphine, taught stretching and strengthening exercises. Then 20th, able to move slowly with walker, psychologically upset, doubts regarding recovery, wishes to go home. Pain is 5/10. That is moderate pain he has. Then wound dressing, no infection. So from all this information, what you have to do, just try to visualize it. How he came. He came with a hip fracture due to a road traffic accident. Then they have done open reduction and internal fixation. Then the pain was managed with the morphine. Then the subsequent days his condition has improved. Then started on physiotherapist. He has taught him initially with the walking aid, assist him. Then stretching and strengthening exercise he was taught. After that, with the help of walker, he started to mobilize. But even though there is a progress in his condition, he is concerned about his recovery and he wants to go home as soon as possible. Then the wound dressing is intact, there is no infection. So 24th, again assisted mobilization and self-care. He started to do his care. Then weight bearing and non-weight bearing exercises by he was done. This physiotherapist encouraged him to do this and taught him to do this exercise. Then educated about long-term complications after surgery. Then what is the discharge plan? Continue physiotherapy at home to regain mobility. Then education regarding safe exercise programs, effective use of walking aids. Then diet management, self-care assistance, return to hospital for occupational therapy appointment after 1 month. See your GP for a follow-up appointment. So from this discharge plan, we have to see whether these all information are relevant for this physiotherapist. There are some for the GP, some the diet management. Is he the one doing diet management? That is a dietitian, or if it is for the nurse, she can assist. So we should select or take only the relevant information for the reader. Don't take all information and don't try to copy the information and paste in our letter. So you will not get the score. I think it's clear for you. So we can see what all information we can include and how to write an example letter. Let's see. So the reader is Mr. Alvaro Morte, physiotherapist, Newtown, Spain. Then the date, as I mentioned before, today's date is 24/10/2015. So the salutation, dear Mr. Morte. Reference, Mr. Sergio Marquina, aged 40. If the date of birth is given, you can choose the date of birth instead of age. Then how we can start the introduction? I am writing to refer because it's a referral letter, or you can write also the purpose of this letter is to refer Mr. Sergio Marquina, who has been recovering after an open reduction and internal fixation. If it's a surgery, don't use any articles. He requires rehabilitative care and assistance following his discharge tomorrow, because the discharge date is 25/10/2015. Then these dates are mentioned here. If it's 1 month, we can just write 30 days. And if here it's 15th he came and we are writing on 24th, so 9 days. So we have to paraphrase or use synonyms. Don't try to write the exact word from the case note, because it will not give you the marks. So we can write 9 days ago, Mr. Marquina was admitted to our facility due to hip fracture after a road traffic accident, for which he has undergone the above mentioned, or you can write aforementioned surgery. Then next, what happened? Post-operatively, he was treated conservatively, because you are writing to a physiotherapist. He doesn't know about the medications name and all, so you can just write. Then these all dates are mentioned here, but no need to mention one by one. You can just concise and write. On his subsequent days, physiotherapy has been initiated for him. Why I used has been? Because it needs to continue even after discharge. So at that time you can use has been. Initiated for him, including weight bearing and non-weight bearing exercises, along with the stretching and strengthening exercise. So we concise all together. No need to write one by one. Then the treatment we have already mentioned here. Then what is his current condition? We can write here. Currently, Mr. Marquina has attained a good recovery. Now he can ambulate with the aid of a walker and is able to perform personal care. Here it's mentioned self-care. I paraphrased as personal care. Mobilization is paraphrased as ambulate. Then what else they have done? He was counseled regarding durable post-operative complication. Here is a long time. The synonym is durable. Educated, you can use counseled, we can tell, no problem. Regarding durable post-operative complications, since he was psychologically upset and was concerned about his recuperation. Recuperation, the synonym of recovery, because it's mentioned here, he has doubts regarding recovery. So he is so worried and concerned about his recovery. So we can mention that. Then maintain this word count, we can write the social history. Actually, it's semi-relevant only. It doesn't need to provide the care for him, but we can just use to make 180 words. Mr. Marquina is a retired professor. His medical history is unremarkable because there is no history of any medical illness. So we can just write is unremarkable. Then next move on to the recommendation paragraph. Considering the above information, it would be appreciated if you could visit Mr. Marquina at his home and pursue physiotherapy in order to regain his mobility. Because here it's use continue, don't use the same, you can just use the synonyms. Then always be polite in the recommendation paragraph. Don't use should, must, like that is like order. So kindly educate him regarding safe exercise programs and effective use of walking aids. Of note, we are specifically mentioning just insignificantly, we are telling this of note. He has an occupational therapy appointment at hospital after 30 days because it's mentioned here 1 month. I just used 30 days. Then then the conclusion sentence. Please do not hesitate to contact me if you have any queries regarding Mr. Marquina. Then the name of the reader is mentioned, so we can use yours sincerely. What was our position? Here it's mentioned only you are a nurse working in the National Hospital, so we can just write registered nurse. Even though you did not mention National Hospital, that's enough because the OET website, they are telling that just your position, that's enough. I think it's clear for you and easy to understand how to write OET letter. If you follow the right technique, and actually there is no specific way of writing letter. What do you think? And it depends on the reader, we can make changes in the letter. So just try to practice and try your own way to write the letter. Don't use any templates, so you can get your required score in this letter. Okay, thank you for supporting me, and share and subscribe. Even though there are likes of views, but the subscriber level is low, so please subscribe, like and share. Thank you very much.